World Cancer Day. World Cancer Day is an international day observed every 4 February to raise awareness about cancer, encourage its prevention, and mobilize action to address the global cancer epidemic. In this video, we will share important information about cancer and how to prevent it. What is cancer? Cancer is a disease that occurs when changes in a group of normal cells within the body lead to uncontrolled, abnormal growth, forming a lump called a tumor. If left untreated, tumors can grow and spread into the surrounding normal tissue or to other parts of the body via the bloodstream and lymphatic systems. This can affect the digestive, nervous, and circulatory systems or release hormones that may affect body function. According to the World Health Organization, in 2022, there were an estimated 20 million new cancer cases and 9.7 million deaths. The estimated number of people who were alive within 5 years following a cancer diagnosis was 53.5 million. About 1 in 5 people develop cancer in their lifetime, and approximately 1 in 9 men and 1 in 12 women die from the disease. Lung cancer was the most commonly occurring cancer worldwide, followed by female breast cancer, colorectal cancer, prostate cancer, and stomach cancer. Over 35 million new cancer cases are predicted by 2050, representing a 77% increase from the estimated 20 million cases in 2022. In India, according to WHO data from 2022, approximately 14.6 lakh 1,161,127 new cancer cases were reported, with a crude incidence rate of 100.4 per 100,000 individuals. The most common cancer among men was lung cancer, while breast cancer was the leading type among women. Additionally, cancer incidence in India is projected to rise by 12.8% in 2025 compared to 2020. The rapidly growing global cancer burden reflects both population aging and growth, as well as changes in people's exposure to risk factors, many of which are linked to socioeconomic development. Next, we will discuss about types of tumors and types of cancer. Types of tumors. Benign tumors, non-cancerous and rarely life-threatening. Benign tumors grow slowly and do not spread to other parts of the body. Malignant tumors, cancerous, grow faster than benign tumors, and can spread and destroy neighboring tissues. Malignant tumors can metastasize, forming secondary tumors. Precancerous conditions, abnormal cells that may develop into cancer. Types of cancer. Cancer can be classified based on the type of cell they start from. Carcinoma. Carcinoma arises from epithelial cells. Common types of carcinoma are breast, prostate, lung, and colon cancer. Sarcoma. Affects bone or soft tissue. Common types of sarcoma are leiomyosarcoma, liposarcoma, and osteosarcoma. Lymphoma and myeloma. Begins in immune system cells. Lymphoma and myeloma. Includes lymphatic system cancers and multiple myeloma. Leukemia. Affects white blood cells and bone marrow. Brain and spinal cord cancers, known as central nervous system cancers. Next, what causes cancer? Cancer can be caused by a combination of factors. Some are modifiable, and reducing these risks can prevent over 40% of cancer cases. Modifiable risk factors are alcohol consumption. Increases risk of cancers such as bowel, breast, mouth, throat, esophageal, liver, and stomach. Being overweight or obese, linked to an increased risk of 12 types of cancer, including bowel and pancreatic cancers. Diet and nutrition. High intake of red meats, processed meats, and salted foods, and low intake of fruits and vegetables impact cancer risks. Physical activity. Regular physical activity helps reduce cancer risks. Tobacco use. Tobacco contains carcinogenic agents responsible for 22% of cancer deaths. Ionizing radiation. Includes radon, X-rays, gamma rays, and ultraviolet radiation, linked to an increased risk of cancer. Workplace hazards. Exposure to substances like asbestos increases cancer risks. Infection. Viruses like HPV and hepatitis B and C can cause cancer. Non-modifiable risk factors are age. Cancer risk increases with age. Carcinogens. Substances that alter cell behavior. Genetics. Inherited genetic predispositions increase cancer risk. Immune system. Weakened immune systems increase cancer risk. Next, what are signs and symptoms of cancer? With so many different types of cancers, the symptoms vary and depend on where the disease is located. However, there are some key signs and symptoms to look out for, including unusual lumps or swelling, Cancerous lumps are often painless and may increase in size as the cancer progresses. Coughing, breathlessness, or difficulty swallowing. Be aware of persistent coughing episodes, breathlessness, or difficulty swallowing. Changes in bowel habit, such as constipation and diarrhea, and/or blood found in the stools. Unexpected bleeding includes bleeding from the vagina, anal passage, or blood found in stools, in urine, or when coughing. Unexplained weight loss, a large amount of unexplained and unintentional weight loss over a short period of time. Fatigue, which shows itself as extreme tiredness and a severe lack of energy. If fatigue is due to cancer, individuals normally also have other symptoms. Pain or ache includes unexplained or ongoing pain, or pain that comes and goes. New mole or changes to a mole, look for changes in size, shape, or color, and if it becomes crusty or bleeds or oozes. Complications with urinating includes needing to urinate urgently, more frequently, or being unable to go when you need to, or experiencing pain while urinating. Unusual breast changes. Look for changes in size, shape, or feel, skin changes, and pain. Appetite loss, feeling less hungry than usual for a prolonged period of time. A sore or ulcer that won't heal, including a spot, sore wound, or mouth ulcer. Heartburn or indigestion, persistent or painful heartburn or indigestion. Heavy night sweats. Be aware of very heavy, drenching night sweats. Most of the signs and symptoms mentioned here are likely due to something less serious than cancer. But early detection is crucial if it is cancer. If you notice any changes that aren't normal for you or something that persists, don't hesitate to speak to your doctor. Even if it's not on this list, it's important to get it checked out. Remember, cancer can be treated well if detected early. Thank you.